Hey everyone, welcome back to The Explainer. Today we're diving into the absolute marvel that is neurosurgery. We are going to unpack the exact anatomical maps and the incredible surgical methods that operating room professionals use every single day to navigate the human nervous system. When you hear the word neurosurgery, your mind probably jumps straight to the brain, right? I mean, it's the star of the show. But let's kick things off with a pretty fundamental question to set the stage for our entire explainer today. Is neurosurgery just brain surgery? Actually, no. Surprise, surprise. A massive chunk of what neurosurgeons do day in and day out revolves around the spine and the peripheral nerves running all throughout your body. Sure, the brain gets all the Hollywood glory, but the real, everyday trench work, that's happening in your back, your neck, and your limbs. So here's our roadmap for today. We'll start by mapping the brain, then we'll explore the spine, followed by operating on the brain, and finally operating on the spine. All right, let's jump right into part one, mapping the brain. Getting to the brain is literally a tunneling process. It's intense. You don't just cut through the bone and boom, there's the brain. After the skin and the bony skull, you hit a layer called the dura mater. Think of the word durable. It is incredibly thick and tough. Right beneath that is the arachnoid mater. Now, arachnoid means spider, and this layer literally looks like a spider web, complete with little gaps where your cerebrospinal fluid flows. Finally, you get to a super thin layer called the pia mater, and only then are you actually touching brain tissue. Now, you might be wondering what we call all those layers together. The fancy medical term is the meninges. That's the dura, arachnoid, and pia mater combined. And that word probably rings a bell, right? Meningitis. When someone has meningitis, it's not actually an infection of the brain itself. That's encephalitis. Meningitis is specifically a really dangerous inflammation of those exact protective meninges layers we just talked about. Understanding these exact layers is absolutely crucial, especially because it dictates how traumatic brain injuries behave. Let's look at the stakes here. An epidural hematoma means blood is pooling outside that tough dura layer. This usually happens with a skull fracture tearing a high-pressure artery. Because it's arterial blood, it expands violently fast. It's a massive, life-threatening emergency. On the flip side, a subdural hematoma happens below the dura. This usually involves venous blood, which is under way lower pressure, so it grows a lot slower. Don't get me wrong, both are terrible, but that epidural hematoma, that is a 0-second-to-spare race-against-the-clock emergency. Once a surgeon finally gets inside, they have to navigate around the 12 cranial nerves sprouting from the base of the brain. To memorize all 12 of these in perfect physical order, starting from the olfactory nerve for your nose at the very front, all the way to the back of the skull, medical students use a totally classic, kind of cheeky memory trick. It goes, oh, 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 to touch and feel, very good velvet, ah, heaven. The first letter of every single word perfectly matches the name of a cranial nerve, moving strictly front to back. It's brilliant. Moving right along to part two, exploring the spine. When we look at the entire human spine, we're dealing with a grand total of 33 different vertebrae sections. That covers everything: the bones in your neck, your mid-back, your lower back, all the way down to the sacrum and the coccyx at the very bottom, which are actually tiny bones that fuse together as we grow up. So, how on earth do you remember how many vertebrae are in each main section? Well, just think about your stomach. Think about when you eat your 3 daily meals. You grab breakfast at 7 o'clock, lunch at 12, and dinner at 5. That schedule perfectly matches your spine. You've got 7 cervical vertebrae in your neck, 12 thoracic vertebrae in your mid-back, and 5 thick lumbar vertebrae down in your lower back. Pretty neat, right? As we travel further down the spine, we hit this absolutely fascinating biological quirk. There's a structure called the cauda equina, which literally translates from Latin to horsetail. And get this, your actual spinal cord stops growing before your spine bones do. The cord itself ends right around your upper lower back. But as your bones keep growing, they literally pull the remaining nerve roots down into this loose bundle hanging in your lower spine. And honestly, it looks exactly like a horse's tail. This specific anatomical layout brings us to a huge difference in how we manage pain. Take an epidural, for example. The needle stays outside the dura, in the fatty space. A tiny catheter slowly drips anesthetic in, which takes maybe 10 to 30 minutes to really numb the nerves. But you can leave that continuous drip in for a long time. A spinal block is totally different. The needle actually pops through the dura directly into the space where the cerebrospinal fluid lives. It's just one quick injection that gives you instant relief, but because it goes so deep, you absolutely cannot leave a catheter in there. Okay, let's get into the surgical methods. Part 3, operating on the brain. The bread and butter procedure up here is the craniotomy. The name literally means making a hole in the cranium to access the tissue underneath. It is a vital, high-stakes procedure used to tackle things like an arterial aneurysm. Imagine a dangerous swollen bulge on the wall of a high-pressure artery, usually right where it forks. Surgeons perform a craniotomy to get in there and carefully place a microscopic mechanical clip right across the base of that bulge, pinching it off completely to save the patient from a catastrophic bleed. Another intense condition neurosurgeons tackle is hydroencephaly. You've probably heard it called water on the brain. Deep inside your brain, you have these chambers called ventricles, and they're lined with a special tissue called the choroid plexus that constantly produces your cerebral spinal fluid. But if that fluid gets blocked and can't drain, it starts pooling up. It essentially turns into a pressurized balloon, putting immense crushing pressure on the delicate brain tissue from the inside out. So how do you fix it? The solution is essentially a brilliant plumbing fix called a ventricular peritoneal shunt. Surgeons literally install a new drain. They place a shunt tube straight into those pressurized brain ventricles, route it safely under the skin, down the neck, through the chest, and drop it all the way down into the peritoneum, which is your abdomen. That way, the excess fluid safely drains away into the belly, where your body just naturally reabsorbs it. Problem solved. Now, what if a patient has a tumor on their pituitary gland? That gland sits dead center, right at the base of the brain. Going all the way through the top of the skull would be a nightmare. So surgeons actually take a crazy shortcut, a procedure called a transsphenoidal hypophysectomy. They literally operate straight up through the patient's nose. They go through the nasal cavity, punch right through the sphenoid bone, and reach the pituitary gland from underneath. Honestly, it's an absolute masterclass in anatomical navigation. Finally, let's bring it back down the body. Part 4, operating on the spine. A massive, everyday issue surgeons see is a lumbar stenosis. Stenosis simply means a narrowing. In this case, it's the painful narrowing of the gaps in your spine, where your nerves exit. When bone or tissue overgrows and pinches those nerves, it is agonizing. To fix it, surgeons do a lumbar laminectomy. They go in and literally remove the lamina, that curved piece of bone at the back of the vertebra, and the spinous process, to open up the canal and finally give those trapped nerves some room to breathe. If a spinal disc totally gives out or the bones are dangerously out of alignment, surgeons will step in and do a spinal fusion. They strip out the bad disc and permanently fuse the two adjacent vertebrae together using bone grafts, heavy-duty screws, and metal rods. But what is truly wild here is how many angles they can attack the problem from. Depending on the patient's anatomy, a surgeon might use a TLIF or PLIF approach to go in from the back. They could use an LIF to go straight in through your side. Or they might even do an ALIF, where they carefully navigate past all your internal abdominal organs to fuse your spine from the absolute front. Sometimes, though, you don't need a massive full fusion. Maybe the disc is just herniated. Picture a spinal disc kind of like a jelly donut. It has a tough outer ring, the annulus fibrosus, and a soft, squishy center, the nucleus pulposus. If that outer ring tears and the soft jelly center bulges out and hits a nerve, you are in serious pain. Enter the microdiscectomy. Surgeons use a tiny, minimally invasive tube to go down and delicately bite away just that protruding piece of cartilage. The moment it's gone, the pressure vanishes. To wrap things up, let's talk about a peripheral nerve issue you've probably experienced yourself on a micro scale. You know when you hit your funny bone, which, let's be honest, is definitely not funny. You're actually smashing your ulnar nerve right where it passes through a tight groove in your elbow called the cubital tunnel. If that nerve gets chronically pinched and keeps making your fingers go numb, surgeons can do a transposition. They physically cut the elbow tendons, lift your ulnar nerve out of that tight spot, relocate it to a brand new, safer position, and stitch everything back up. It really is wild when you step back and think about it. If surgeons can effortlessly navigate the invisible layers of our brain, instantly relieve agonizing pain by understanding fluid gaps down to the millimeter, and literally rebuild the structural foundation of our spines from any angle, it leaves you wondering, what other incredibly complex, hidden geographic maps inside the human body are just waiting to be explored next? Thank you so much for joining me on this explainer today, and as always, keep questioning the incredible mechanics of the world inside you.